Hello and welcome to Healthcare Matters, the internet television program that explores the intersection of medicine and the law. I'm your host, Mike Matre, and today's guest is Dr. Richard Anderson. Dr. Anderson is the Chairman and Chief Executive Officer of the Doctors Company, the nation's largest physician-owned medical malpractice insurer. Welcome to the program, Dr. Anderson.
Thank you very much. Nice to be here.
In the healthcare industry's quest to reduce the overall cost of medical liability system, experts have recommended a number of alternative dispute resolution structures. They range from mediation and arbitration to specialized health courts. How do you feel about these alternative dispute resolution ideas, and do you endorse any of them?
I mean, first of all, I'd say that we have the worst. It's like Winston Churchill said about democracy. It's the worst of all political systems except for all the others. And I kind of feel that's what we have now. It's clear that our system of medical legal jurisprudence is broken. We have infinitely too many suits. More than 80% of all medical malpractice claims close with no indemnity payment whatsoever, zero indemnity payment, meaning that for practical purposes, you can use the word frivolous, but if you don't want to use the word frivolous, then you can use the word that they were futile. In other words, the doctor and the patient went through the cost and frustration and angst and anger and emotional turmoil of 3 to 4 years of litigation and ended up zero. No money changes hands, complete waste. So anything that would reduce that onslaught of unnecessary litigation would be a major reform. In terms of which reforms are most likely to be effective, it's a hard question because the devil's in the details. Almost all of the reforms that have been proposed and that you mentioned are well-intentioned, and some of them could work quite well. Mediation and arbitration. Mediation is not so much. Mediation can work well just because it gets both sides talking. Arbitration, which has the ability to be, can be designed as a compulsory program, can also fast-track litigation, take some of the emotion out of the process and reduce the length of it, reduce some of the frictional costs. But again, the devil's in the details. Who's the arbitrator going to be? Is there going to be a right of appeal? In some states, for example, that have arbitration, the physician may win an arbitration, and yet patient decides that they don't like it, they don't like the outcome, and they go to court anyway. Well, then the arbitration's been a complete and utter waste of time. And so really the devil's in the detail. The other alternative that you mentioned, healthcare courts, is certainly a very attractive alternative. And again, you'd have to design a complete system. But the notion of having real experts whose primary allegiance was to truth rather than to the side which is paying their hundreds of dollars an hour fees, and unbiased and unemotional decision making, and begin to separate medical standards of care from medical legal standards of care, and take some of the emotion out of medical malpractice litigation, because certainly emotion, especially anger, is a core element of medical malpractice litigation. I think those are things, and one other major point, if you really did have true expert medical courts, you could presumably establish pretty clear-cut precedents. And if you had clear-cut precedents, then every physician could at least feel that he or she understood what the rules are. Right now, the way our system works, we can talk about the standard of care. We think we know what the standard of care is. But at the end of the day, in every single medical malpractice claim, it's the judge or the jury that finally makes their own decision on what they think the medical standard of care is, or even worse, it's what they think the medical care should be. And I say even worse because they're applying it retroactively. So yes, there's a lot that can be done to reform the medical malpractice system, but it's a heavy lift.
Dr. Anderson, thank you for taking the time to visit with us today.
Well, thank you very much. It was a great pleasure. Thank you.
You live in California, a state that instituted the Medical Injury Compensation Reform Act, or MICRA, in 1975. It's considered the gold standard of medical liability tort reforms. As a result of MICRA, California has some of the nation's most affordable medical malpractice insurance premiums. Can you walk us through MICRA and what are its most effective provisions?